Hi, I'm Natasha, a registered nurse and care management strategist. I help healthcare organizations implement technology supported care management models that improve patient outcomes while also increasing practice revenue. I also teach nurses how to build care management businesses aligned with how healthcare is actually being reimbursed today. Today, I'm going to talk about chronic care management, what it is, which patients qualify, why it was created, and how it actually improves outcomes. Because this is one of the most important services in healthcare, and a lot of people still don't fully understand it. If you have a patient with multiple chronic conditions, diabetes, hypertension, heart failure, do you really think a 15-minute visit once every few months is enough to manage that patient? That's exactly why chronic care management was created. Chronic care management, or CCM, is a Medicare service designed to provide ongoing, non face to face care for patients with chronic conditions. This means the patient does not have to be seen in person for CCM to be provided. This care happens between office visits, not during the appointment, but after the patient goes home. CCM includes services like monthly check ins with patients, medication management, care coordination, monitoring symptoms, updating care plans, patient education and support. Most importantly, it ensures that someone is consistently following up with the patient. Now, let's talk about which patients qualify. Chronic care management is a Medicare service, and it is also covered by many Medicare Advantage plans. To qualify, a patient must have two or more chronic conditions expected to last at least 12 months or until the end of life. These conditions place the patient at risk of death, acute exacerbation, or worsening of their condition, or functional decline, difficulty performing activities of daily living. So, we're talking about high risk patients who need ongoing support. These are the patients who often fall through the cracks when there's no structured follow up in place. Now, let's talk about why Medicare created CCM, because this is where people miss the bigger picture. Healthcare was built on a fee for service model. Providers were paid for visits, tests, and procedures, but that model is not sustainable. There's little focus on preventive care, and patients often receive no support after they leave the office. So, Medicare introduced chronic care management in 2015 as part of a shift to value based care. The goal was simple: improve outcomes for patients with chronic conditions while reducing unnecessary hospitalizations and overall costs. And the way to do that was through consistent, ongoing care. The quadruple aim is a framework that guides value based care. It focuses on four key things: improving the health of populations through proactive preventive care, enhancing the patient experience by improving quality, safety, and satisfaction, reducing the total cost of care through better coordination and efficiency, and improving the work life of healthcare providers to reduce burnout and support sustainability. This is important to understand because chronic care management directly supports all four. It helps patients stay healthier, it improves their experience with care, it reduces unnecessary hospital visits and costs, and it supports providers by giving them a structured way to manage complex patients. Now, let's talk about what actually changes when CCM is implemented correctly. Patients are no longer left on their own after a visit. They have someone checking in on them regularly. They have someone who reinforces education, catches issues early, helps them stay on track with medications, coordinates care across providers. Because of that, hospitalizations decrease, emergency room visits decrease, chronic conditions are better managed, patients feel more supported and engaged. This is what happens when care is continuous instead of episodic. This is where nurses are positioned to lead because this work is not about quick visits. It's about relationships, education, coordination, and follow through. Everything nurses are already trained to do. Chronic care management gives structure to that work, and it gives providers a way to deliver better care while also being reimbursed for it. So when you hear chronic care management, I don't want you to think of it as just another service. This is a solution to one of the biggest problems in healthcare, the lack of follow up and support for patients who need it the most. If you're a nurse and you want to learn how to step into care management or build a business around services like CCM, I share more inside my school, Empower Care Academy. I'll leave the link below. And if you're a provider looking to better manage your chronic patient population while improving outcomes and increasing revenue, this is a model you should be implementing. Make sure you like this video, subscribe to the channel, and I'll see you in the next one.